Can allergy medication cause constipation? Yes, and it's more common than many people realize, especially with certain types of antihistamine. If you've ever noticed your digestion feeling sluggish after starting an allergy medicine, you're not imagining it. This is a recognized side effect, and understanding why it happens can help you manage it properly. So let's get into it. Allergy medications, particularly older, first-generation antihistamines, can slow down your bowel movements. This happens because of something called anticholinergic activity. These medicines don't just work in your nose and airways, they also block receptors in your digestive system, which reduces the muscular contractions your gut needs to move things along. That process is called peristalsis, and when it slows down, you can end up with harder stools, less frequent bowel movements, and that uncomfortable bloated feeling that comes with constipation. First-generation antihistamines, things like chlorphenamine and promethazine, are the ones most associated with this effect. They're still used, particularly in older medicines and some nighttime formulations, so it's worth knowing they carry this risk. Older adults and people taking several medications with similar properties may be more susceptible. Second-generation antihistamines like cetirizine and loratadine are generally less likely to cause this problem. They're more selective in how they act on the body and don't have the same level of anticholinergic activity. That said, everyone's different, and some people may still notice digestive changes even with these newer options. If you're using a nasal spray, either an intranasal corticosteroid or an antihistamine nasal spray, the risk is lower still. These work locally with very little absorption into the rest of the body. So constipation is unlikely with these formulations. Now, what can you actually do about it? If you're experiencing constipation while taking an allergy medicine, there are some straightforward first steps. Increasing your dietary fiber through things like whole grains, vegetables, and pulses can help keep things moving. Staying well hydrated is equally important, as water helps soften stools. Regular physical activity also supports healthy gut motility. These lifestyle measures are considered the first line of management for medication-related constipation, so they're a good place to start. It's also worth having a conversation with your doctor or pharmacist about whether your current allergy medication is the right fit for you. There may be alternatives, such as a second-generation antihistamine or a nasal spray, that control your symptoms just as effectively but with less impact on your digestion. Never stop or switch a prescribed medication without speaking to a healthcare professional first. And if you do experience side effects from any medication, you can report them through the MHRA Yellow Card scheme at www.mhra.gov.uk/yellowcard. On the safety side, most cases of medication-related constipation are mild and manageable, but there are times when you should contact your GP. If constipation persists, despite making lifestyle changes, if you're experiencing severe abdominal pain, or if you notice any blood in your stool, please seek medical advice promptly. These symptoms need to be properly assessed to rule out any other underlying causes. And as always, nothing in this video is a substitute for personal medical advice. Your doctor or pharmacist is the right person to guide you based on your individual health and circumstances. So to recap, first-generation antihistamines can cause constipation due to their anticholinergic effects on the gut. Second-generation antihistamines and nasal sprays are less likely to have this effect. And if you are affected, lifestyle changes are a good first step, but do speak to a healthcare professional if things don't improve or if you have any concerning symptoms. Have you ever experienced digestive side effects from allergy medication? Let us know in the comments. We'd love to hear from you. And if you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more straightforward health information.